This is a wearable vest, and it uses radar technology. It's made by an Israeli company using military technology to measure the amount of lung water in the right middle lobe of the lung.
The clinician can use that measurement of lung wetness or dryness to titrate, to change medication doses, to keep patients in a healthy state and to reduce their risk of heart failure hospitalization.
If we can identify in the emergency room whether or not it's fluid or not, we may be able to save those patients from coming into the hospital and manage them more closely as an outpatient.
What we've needed for a long time is a more accurate and an actionable measurement of heart failure clinical status. We get that with REDS.
Now we have a device that lets us know in 90 seconds whether or not there's a lot of fluid there or not.
The old-fashioned way where we waited until patients were more symptomatic and sicker, now we can head this off before patients even know that they're getting worse.
Patients love this technology. Over and over, patients say, listen, it gives me reassurance. It lets me know.
It eases my thoughts because now they know the exact number.
There are many other ways in which the REDS can be used and the data can be valuable. For example, it might be used in an emergency department. It can be used in the hospital to monitor the adequacy of treatment and diuresis and to determine the best timing of discharge for patients. It might be used in the clinic just for a spot check as patients come back to correlate it with their signs and symptoms and other measures of heart failure disease severity.
Who would have thought a vest could measure your fluid intake in your body? Whoever invented that was good.
Really, this is a big, huge burden on our healthcare system, and the REDS technology has the opportunity to reduce all of these aspects of hospitalizations.
It's pretty good technology, a pretty good weapon to have in your arsenal.
Who knows how, if they didn't have all this, how would it be? Would I even be sitting here right now?
We need better tools like REDS to help us improve patient status, keep them well, and keep them out of the hospital.
This device is a win-win-win. It's a win for everyone.